Hi everyone, this is another high yield session. So in this again we are going to discuss few clinical case based questions and few MCQs, right? So let's move on to the session. So the first case is a 55-year-old person was diagnosed with type 2 diabetes, and the diabetologist asked him to get HbA1c estimated, and his report it was given along with a special mention that there was an abnormal migration of hemoglobin in electrophoresis. So that's what was given in the report, and his SpO2 was normal. Yes, so even if you did not come to a conclusion of what the diagnosis is, just read the questions, sub questions given. They have asked you what type of mutation is this, and they have asked you to classify the effects of mutation on nucleotide sequence, amino acid sequence, and function of protein. So which disease have you learned? No, which disease in the sense we can, what disease can it be? There is some hemoglobinopathies, because they have mentioned an abnormal migration of hemoglobin. There should be some abnormal hemoglobin, is it not? So there can be a defect, there can be any hemoglobinopathies. That's what you can come to a conclusion here. And what mutation have you learnt in any of the hemoglobin? Which mutation have you learnt in detail? Yes, of course. I think in sickle cell anemia you have learnt, is it not? Sickle cell anemia, what is the mutation that we have learnt? It's a point mutation. Yes, we have learnt it is a point mutation, and also we have learnt that here the amino acid glutamate is converted to valine, and that is what is the reason for all the manifestations that you find in sickle cell anemia. So with this you'll be able to answer the second question also, is it not? So we can classify based on the effects of mutation on nucleotide sequence, amino acid sequence, and function of proteins. And then few examples we will give to this. All right, so let's see how we are going to answer this question. So what type of mutation is this? Yes, what type of mutation is this? And before that, I've got few pictures for you, just to tell you what is the connection between HbA1c and hemoglobin migration. Yes, so the first, this picture tells us this is a HPLC report. Okay, this is a high performance liquid chromatography HPLC report for hemoglobinopathies. So for screening for hemoglobinopathies we do this. Yes, the next picture, this picture, second picture tells us this is a hemoglobin electrophoresis. Yes, this is a hemoglobin electrophoresis. Just know few points on how to read this. Okay, so that is you have, what all you have to know is what is the fractions of hemoglobin. So you know there is adult hemoglobin HbA fraction, you also know HbF fraction, then you know HbA2. Yes, HbA2, and then you know HbA1c. Yes, this is HbA1c is what is related to diabetes, and then you know there is HbS. Okay, and then you know there is HbS. So HbS, where do you find HbS? We always find it in sickle cell anemia. Yes, whether in sickle cell anemia or sickle cell trait, only in sickle cell we find HbS hemoglobin, whereas HbA we find this is an adult hemoglobin. This is a normal hemoglobin that you find in an adult, and it should be more than 80%. Yes, more than 80% of the hemoglobin should be adult hemoglobin. HbF is the fetal hemoglobin, and this should be less than 2%. Yes, in an adult, if you measure HbF, it should be less than 2%. Then HbA2 fraction normally should be less than 3.5%. Yes, 3 to 3.5% should be less than 3 to 3.5%. Now, just read the first, let us just interpret the first graph, which is HPLC report. Here, as you can see, they have mentioned A1C. Can you see this A1C? A1C they have given as 11. Okay, what is a normal A1C is nothing but HbA1c. So what is normal HbA1c? It should be 5.4 or less, is it not? Anything more than that should be considered pre-diabetic and then diabetic. So HbA1c they have given as 11.1. So without any symptoms, or in any patient, if there is more of HbA1c, you should also think about other possibilities. You should think about hemoglobinopathies here. Also in the report you can see there is an S window. So S window suggests that this is HBS. Okay, so HBS is about 31. Okay, 31. You normally, do you find normally in an adult normal healthy patient, do you find HBS? No. So normally you don't find HBS, but if there is a sickle cell window, then it means that the patient is suffering from sickle cell anemia. Alright, so depending upon the fraction, we also know how severe it is. Alright, so here there 31% of hemoglobin is HBS. And look at HbA0. What is A0? A0 is nothing but the adult hemoglobin, normal hemoglobin. That is around 50%. Okay, I told you HbA should be more than 80%, but here in this case it is about 50%. So it means that the HbA level has reduced, HbS level is increased. Yes, and also can you find that you should know the fact that HbF, yes, HbF can elute along with HbA1c. Okay, HbF can elute along with HbA1c. Okay, so that is why maybe this is the reason that along with HbF and HbA1c the fraction is little bit more here. Okay, so what is the take home point here? Let me tell again. HbA1c you can find it to be 11.1, but there can be some other reason. So you find HbS in this patient, you find reduced HbA in this patient. So you can come to a conclusion that the HbF has eluted along with A1c in this report. So this fraction 11% denotes both, okay, denotes the combined percentage of HbF and HbA1c. It means that HbF fraction is also little bit increased here. Okay, it means that HbF fraction is also little bit increased here. So in sickle cell anemia, okay, in sickle cell anemia, what do you find? In sickle cell anemia, this is the picture that we find. We find reduced HB adult hemoglobin. We find increased HB, yes, and also we find HbF, increased HbF here. Alright, this is what is sickle cell anemia. Now, what is the difference between sickle cell anemia and sickle cell trait? Sickle cell trait is a heterozygous condition. Okay, it is a heterozygous condition. Heterozygous condition in the sense the patient will have both HbS as well as HbA. Okay, here they will have both HbS and HbA, but sickle cell anemia will be a severe form in which they will have more of HbS. Okay, more of HbS only. Understood? So if you can see this electrophoresis picture, okay, if you can see this electrophoresis picture, you can find normally, yes, normally what do you find? The HbA fraction, you find it, this is the origin of application. Okay, this is the origin of application of the sample, and HbA fraction has run so far to the end of the slide. Yes, so you find HbA to form a band at the end of the slide, and closer to it you find HbF. Alright, and then you have a minor HbA2 fraction. So this is what is a normal hemoglobin electrophoretic pattern. Now in sickle cell trait, what do you see? In sickle cell trait, I told you, you find both HbA as well as HbS. Okay, so they will have minor symptoms compared to that of sickle cell anemia, which is a homozygous condition in which there will be excess of HbS only. Okay, excess of HbS only. Okay, so and also you will have more of HbF, fetal hemoglobin also. All right, yes. So this is what is a sickle cell trait and anemia picture that you should understand. So in sickle cell trait, what do you find? You find both HbS and HbA fraction, but in sickle cell anemia you find more of HbS and also HbF fraction. Okay, HbF fraction. Is it clear, all of you? Similarly, in beta thal trait, what do you find? In beta thal trait, you find increased HbA2. Okay, you find increased HbA2. So whenever in a report they have given you there is increased HbA2, then it means you have to think about beta thal trait. And beta thal major, if in case it's given, then it would be increased HbF. That is what is very suggestive of beta thal trait. Alright, so this is how you should interpret hemoglobin electrophoresis and HPLC. Yes, so maybe this is beyond your level. As an MBBS student, it's beyond your level, but still at this stage you will have to know that in sickle cell anemia, yes, in sickle cell anemia is a severe form wherein you will have more of HbS. In sickle cell trait, you will have more of HbS as well as you will have some HbA also. Okay, normal hemoglobin also you will have, sickle hemoglobin also you will have in circulation. Whereas in a diseased condition, you will find more of HbS form only. Okay, so that's what you should understand. And then in trait, okay, in beta thal trait there is HbA2, you must know this. And in beta thalassemia major, which is a severe form, you will have more of HbF fraction. Okay, so this is how you have to interpret. So here they have given us in electrophoresis there is an abnormal migration of hemoglobin. Yes, along with the mutation they have asked us. So we will take this to be a sickle cell anemia case. Okay, so we will take this to be a sickle cell anemia case, right? Yes. So again in HPLC only HbF and HbA1c will elute together. Okay, that also you have to understand. In HB electrophoresis, you will find normal hemoglobin, sickle hemoglobin, both to be present in case of trait, and more of HbF and more of HbS to be found in sickle cell anemia. So this is what you have to understand. All right. Yes. So what are the types of mutation? So what are the types of mutation? What is this type of mutation here in the question? The sickle cell anemia is a type of point mutation. Okay, it's a type of point mutation. That's what you have to understand. So how will you classify this mutation? Point mutation, one thing is you classify it as silent mutation, missense mutation, and then nonsense mutation, right? What is silent mutation? As the name says, silent mutation means you do not have any effect. Okay, you do not have any phenotypical effect because one amino acid has converted to another amino acid. So you all know that because of wobbling phenomena, because of degeneracy of genetic code, you have this codon CUA. Even if it's mutated to CUC, both of them will code for leucine. So leucine has one amino acid can have more than one codon. Yes, so in that context you can understand that even if there is point mutation which has occurred in these two codons, both of them code for leucine. Yes, both of them code for leucine. So here the amino acid sequence is not altered, so the protein that is formed is not altered. Okay, protein that is formed is not altered. So here you call this point mutation to be a silent mutation. Okay, the next one is missense mutation. Missense mutation, again you can classify them to be of three types. One is acceptable mutation, partially acceptable, and then unacceptable. Yes, so as you can see in this example, acceptable missense mutation is HbA. Okay, let's come from codons only. Here they have given us codons, what amino acid has been altered and what's the protein that has got altered. Okay, so in codons what change has happened? AAA to AAU has what has happened here. Yes, here and what has happened is lysine has got converted to asparagine. So HbA adult hemoglobin has become HB Hikari. Okay, the HbA has become HB Hikari. This is a protein molecule, but still there is no, the patient is able to survive. There is no that much symptoms in this patient. So you call this as a acceptable mutation. Whereas partially acceptable mutation is what? Partially acceptable mutation is See here you get GAG to GUG or GAA to GUA. What has happened? Glutamate has got converted to valine in the 6th position of the beta globin chain. So HbA has become HbS. Yes, so even in this, if it is a sickle cell trait heterozygous condition, the patient has can survive better. Okay, in deoxygenated state only the patient would get more of sickling crisis. If the patient is oxygenated adequately, then the patient will not have that much symptoms. So it is partially acceptable. Okay, so what type of mutation that you can tell here? Sickle cell is a partially acceptable missense mutation. What is it? It's a partially acceptable missense mutation. Is what is this? Missense point mutation is what is sickle cell anemia. All right, then non-acceptable missense or unacceptable missense is what? Here what has happened? HbA has got to HbM. HbM is what? HbM is a hemoglobin that is more prone for forming methemoglobin. So there is methemoglobinemia here. Yes, which is not acceptable. So this is unacceptable missense mutation. Okay, so these are the examples. For missense mutation you have 3 types. Acceptable missense, in which HbA to Hb Hikari, it's okay, it can be acceptable. There is no it doesn't affect the patient's life. Partially acceptable is also you can handle it, HbA to Hbs. Unacceptable is it's not, it becomes the protein becomes dysfunctional or incompatible with life. So HbM, there is more of methemoglobinemia, which cannot be treated that much. It's full of symptoms. Alright, this is missense mutation. The third type of mutation is nonsense mutation, in which in between what happens, a codon gets converted to a stop codon. So there is the protein is terminated. There is premature termination of the protein. All right, or what can happen? There can be elongation of the protein. So the stop codon has got converted to another amino acid codon, so the protein gets elongated. So the example for termination of protein is beta thalassemia. What is beta thalassemia? Here again, beta thalassemia, what happens? There is reduced synthesis of the globin chains. Either alpha or beta globin chains synthesis is being reduced, right? So this is what is nonsense mutation. So these are the 3 types of mutation, and that's what is being asked in our question also. This type, what is the type of mutation here? Sickle cell anemia, it's a point mutation, partially acceptable missense mutation. Now we have classified the mutation based on the nucleotide effects on nucleotide sequence, amino acid sequence, and function of protein, is it not? So we know it is a silent mutation, missense mutation, and in missense we have the acceptable, acceptable, partially acceptable, unacceptable, and then we have nonsense mutation, along with examples also we have seen, right? So this is all that you have to know under this case, right? So next we'll move on to the next case. Here, 11-year-old boy is diagnosed with type 1 diabetes. He was prescribed human